All right, you crazy cats. We are talking about health care and health insurance. This is not the most exciting topic, but it's super, super important. And medical care is very expensive. If you do not have coverage, then you will be paying a lot of money out of pocket, especially if you've got pills that you've got to take like every single month, and you're not covered. You guys, hopefully if your parents have insurance, you guys will be covered until you're 26. Hopefully you'll get a job before that where they say, hey, I'm going to give you this job and you are going to have benefits. Benefits means that healthcare coverage, the dental coverage, the eye coverage, all of that good stuff. You want to find out what those benefits are because sometimes they say benefits and it's not that great. But you definitely want to get a job where they do cover a lot of your healthcare insurance because it is insanely expensive. You'll be able to differentiate between healthcare plans, calculate cost of healthcare network plans, including benefits. All right, let's get some of this written in. So healthcare premiums, health insurance, it protects you against overwhelming medical expenses. If you guys have an insurance card, make sure you keep it on your body, especially if you are driving or you're going with people who are driving often. God forbid something happens, you have your insurance card on you. If you go to the hospital and they ask you insurance and you're like, I don't even know, you have it on your card, you just hand your card over. Health insurance plans, there's a couple of different ones. A traditional plan offers health care coverage where the healthcare provider is paid a predetermined dollar amount, for the service given. So obviously each doctor that you go to, they charge a specific amount, right, for you to have a doctor visit, especially specialists. Specialists, their amount may be a little bit higher because they specialize in specific stuff. So that is normally a traditional plan. A preferred provider organization is a PPO. This is actually really good. This is what Cheektowaga provides, a little bit of this and a little bit of the next. So it is a group of selected healthcare providers who offer comprehensive services at preset reimbursement levels. So what this means is, I have Independent Health. Independent Health gives you like a whole group of names, and they say, these are the doctors we trust, these are the doctors that we're going to cover you under. That is called in-network. Out-of-network is where you're not completely covered by your insurance or you're not covered by your insurance at all. So that could be like counselors, psychiatrists. It could be specific. I go to a doctor every month that I have to go to, and my insurance does not cover them. They're a private practice. I have to pay $100 a month every single time I go. It's completely out of network. So you definitely want to try to get the doctors that are in your network, unless you really, really, really trust the doctor and you're okay paying that additional cost. So you are required to use these network providers, a select group of doctors, unless you're willing to pay additional costs. And some people do if they trust doctors, and they're like, I want to go to this person, but if they're not I don't get completely covered under them, and I'll pay a little bit more money, and that's fine. All right, so this right here, I'm going to show you this. Make my screen a little bit bigger. So this is the Independent Health. You can do this for your insurance, whatever it is, like Fidelis or Blue Cross, whatever it is. Type it in, and then what they'll do, this is within 15 miles, what they'll do is they will give you a whole bunch of doctors that you are covered under. You can search doctors and see, or you can just call the doctor's office and be like, the first thing they ask you is what kind of insurance do you have, and you say what they have, and they'll say whether or not you're covered or not. And how much it would be if you weren't covered. So try to look at this like if you're looking for a specific doctor. All right, health maintenance is another one. So Cheektowaga kind of does this a little bit too. It's a prepaid health plan in which care providers, I want to say contract, is that it? Yep, contract with or are employees of the HMO. You may select a primary care physician. Primary care physician is just your every single day doctor. You have a cold or you have a sinus infection, you go to your doctor. and you agree to receive all non-specialists. So if they can't help you, they're going to refer you to a specialist. Hopefully you'll get covered under them too. The physician may refer you to a oh yeah, I already said that. All right, so often your employer pays, and this is the important part, to find out how much your employer will pay for your healthcare premium, which is your cost of healthcare every year, 75% to 80%. I want to say Cheektowaga. There's different plans within your healthcare plan. So Cheektowaga may range from they'll cover 94% of my healthcare costs every single year to some plans are 100%. People have different percentages based on what their needs are. So for example, someone who is single is not going to get the same plan I have because I have a whole family I got to take care of. So it's going to cost me a little bit more, but I get covered. That cost per year to have that insurance, a lot of it is paid by Cheektowaga, which is great. The rest of it gets taken out of my paycheck, which is what's going to happen with you guys as well. All right, so we're just going to look at these questions for a second. It says, find the employee's total annual contribution and employee's monthly deduction. So number 1 says, Amy has a single plan. Her PPO annual premium is $4,325. Her employer pays $65. So if Amy's employer pays $65, how much does Amy pay? She pays 35%. So instead of going through how much does the employer pay, find that, then subtract it. We're just going to find out how much Amy pays. So we have 4,325 times, you're finding a percent of something, so you're multiplying by 0.35. So Amy pays, I already did this, $1,513.75, which it seems like a lot, but it's over the entire year. And that's, compared to 4,000, that's not too bad. So this is A. And then B says find the monthly deduction. And that monthly deduction is, so it's just pretty much like your $1,513.75. I want to find out how much you're paying over 12 months, because sometimes it might get taken out of 12 months if you are getting paid once a month. If you're getting paid bi-weekly, it's going to be taken out of that paycheck, which is divided by 26. But because this says monthly, we're just going to do the monthly, which it is $126, and it rounds to 15 cents per month. And that's not too bad to have health care insurance. All right, let's talk about Larry. So Larry has this family plan. His HMO annual premium is $11,473. So that's how much his plan costs for the year. His employer covers 73%. Now it's a lot of it more than Amy's because he has an entire family to cover. So if his employer pays 73%, that means Larry's in charge of 27%. Creasy's making me laugh in the background. He's distracting me. So let's figure out how much he is in charge of. $11,473 at 27%. Larry is in charge of $3,097.71, and that is per year. So that is your answer to A. And then B asks for monthly. So similar to what we did with Amy. Still a lot cheaper than covering that whole thing. Divided by 12. So for the month, Larry is responsible for $258.14 to cover all 4 of his family members. If he does have 4, who knows how many he has. All right. Health insurance benefits. Just because you have health insurance does not mean all procedures are covered. For example, plastic surgery is not covered. I didn't have to get LASIK. I chose to get LASIK. That was not covered. It cost me like $3,500. I had to put on a medical card. So that stuff's not covered. Many health insurance policies have preset deductibles, which is, so just like a car insurance or house insurance, you have to pay a certain amount before insurance actually kicks in and pays for the rest. So deductible could be, depending on your plan, $250. It could be you have to pay $500, then insurance will cover the rest. Like if you spent a night in the hospital, it averages around $11,000 a night. So if you have a deductible that's $250, you have to only pay $250, and then the insurance will cover the rest, which is really nice. That's why it's so important to have insurance. Many insurance policies have preset deductibles. The amount of money you must pay before your insurance kicks in. Some healthcare services have a copayment clause or a coinsurance clause. This requires you to pay either a set amount. So when you go to the doctor's office, it may say like your copay is $5 or $10 or $15, depending on your plan. It could be $40. It could be even more than that. Luckily, we're Cheektowaga, like I was saying that our medical is so good. I have no copayment ever. Like I don't have, my kids don't have it, nothing. It's awesome. Amount or a certain percent of medical expenses, including also prescription drugs. I already wrote drugs. Prescription drugs can be insanely expensive if you do not have medical. So there was one drug that the doctor wanted me to try, like, because I have really bad piping. Like, my intestines are really shot. So he's like, let's try this drug. I went to go get it at the pharmacy, and they're like, your insurance doesn't cover it. I'm like, okay, so how much does it cost? They're like, $425. Like, what? $425, like, for the rest of my life? No, $425 for the month. So I can't even imagine, and I didn't obviously do it, but I can't imagine people who actually have to take medication like blood thinners or something for diabetes or that, and they have no insurance. Like, it's a lot of money. I don't know how they pay for it. All right, so this is an example of a chart that shows network. Remember, network, in network, it means that the group of doctors that your insurance covers, and non-network means it does not cover it, or it doesn't cover it as much. You're going to have this on your homework, so you need to know how to read it. So based on the question is based on which column you're going to be looking at. So it says determine your network plan. So I know I'm looking here, and I'm not looking here. Costs for the following co-payments. I have 7 physician visits. So before I even read the whole thing, I'm just going to go one by one. So if you look here, 7 physician visits. Here's a physician. That's just going to your doctor. Right here. There's $20 to go. That's the co-payment. So we're going to do 7 of those. So 7 times 20. Must have been the flu season. 2 specialist visits. Specialist, again, could be like a dermatologist, so a doctor for your skin. It could be an oncologist, which is your doctor if you have cancer. It could be a gastroenterologist, which is that doctor who checks your piping inside. All right, so we have 2 specialist visits. And if you're looking on the chart, it's right under that physician visit, so the copay for that is $30. So you can just do 2 times 30 if you want to, but I'm going to show it as 2. You can show it as 60 if you want to. I'm going to show it as 2 times 30, so you know where it's coming from. 12 physical therapy appointments, that's the next one, at $90 each. Okay, so if you're following physical therapy, if you look here, there's no copay, but what they'll say is that insurance covers 20% of that total cost. So I'm going to do like a little sidebar over here. I'm going to do 12 times 90 to figure out the total amount for that physical therapy. So a lot of insurances will cover a certain amount of physical therapy appointments. Like I know I had to go, and it would only cover 20 a year, and then after that, you have to pay their full visit. So that's $1,080. That's your total, but you don't have to pay that full. So insurance covers, and I shouldn't have said insurance covers 20%. You cover 20%. Insurance covers 80%. So I'm going to figure out what 20% of that is. So for those 12 physical therapy appointments, you're responsible for $216 of that, which is way better than $1,080. So I'm going to add that to our list of costs over here. All right, so next it says you also have the following pharmacy charges. Okay, I'm going to underline this because I'm almost out of time, and then I'm going to just show you where that comes from. It should come right from the chart. I'm just going to pause it real quick. Okay, as we left off right here, so I have 2 local generic drugs. This 2 times 10 is right here. Careful you're not reading this because it's a mail-in order. The retail generic drug is $10. I got 2 of them. And then I have 1 brand name drug right here, $20. That's what this 20 is right here. That's split. And then I have 3 mail-in order generic at $25 a piece. And then 1 brand name at $50. So that totals $518. I think that's all the time I have. So make sure that you're reading the question. Make sure you're reading the chart on your homework. Okay, bye.